built around a business model focus where we go in and help our clients figure out how to make a sustainable business model out of this. Because you're right, it's not easy. Certainly, one of the things that we've discovered over time is that scale is a necessary but not sufficient requirement for success. So you can't be successful in a risk-bearing contract as a 5,000 life ACO. The random variation is going to kill you. The confidence interval on an ACO that size is like 9%, the 95% confidence interval, and you're trying to save 2, 3, 4, 5% per year, right? So if you save 5%, you're doing great work, but the random noise might take you to show you that you're losing by 4%, right? And you might even write a check someday. So there's the need to be in a large enough ACO, but then everyone in that ACO needs to be doing the right investment in prevention and staffing their teams appropriately. They need to be managing their high risk patients effectively. They need to be documenting and coding effectively. So the figuring out the tools to get the work done in a very strained work environment of physician practices where they all almost everywhere you go feel under-resourced and are low on time because we've put a lot on the plate for physicians, especially primary care physicians. They have more demands on their time than they could possibly meet. And that's why we have to spend a lot of time with them getting their staff straight, getting people to take work off of their plates so that they can use their time most efficiently.
Building on this idea of a collaborative effort that's really necessary to make this work. Caravan, I believe, has and maybe the stats are a little bit updated now, but 26,000 plus providers, 600,000 lives covered, and I imagine a lot of that is providers in competing healthcare systems. And let me know if that's not accurate. But how do you get people to work together? I mean, it's for the common good for sure. But how do you get people to sort of work together and not butt heads to go through this system?
Yeah, we have mostly managed to avoid direct competitors working together, and there's a lot of reasons to prefer that. We mainly around data sharing and the difficulties that you run into if you are in rooms frequently with competitors. But it comes up more the more clients we add, certainly. So it is possible to work with competitors in our model, and we have seen it done successfully. The hard part is that there is just a lot of different actors in any successful model here. There's a need to get system buy-in. There's a need to get clinic buy-in. There's a number of technical factors that you have to work through with IT staff and quality reporting staff and compliance and all of that before you even get to redesigning primary care workflows. So that's really where we've developed our best use cases and our best models. And the proof of concept of that, and it was in 2018 that we started really bringing our client. We had 38 ACOs at the time, and we started collapsing them to larger and larger ACOs because we were saving 3% for the government on average, which should have generated about 1.5% in shared savings payments for our clients. But because of this small ACO problem, many of them were not meeting their minimum thresholds. The minimum threshold goes down the larger you get, and the reliability, the precision of the estimates goes up. So we're now managing with our partners about 12 ACOs in 2020 last year. And since we've created these large national collaboratives, we had a 240,000 life single ACO with 129 health systems in it in 2019, and then similar arrangements in 2020. Our clients are going to be receiving $120 million in shared savings payments on the basis of those 2 years, 2019 and projected for 2020. 73% in 2019, 86% in 2020. That's against national averages of about 50%. So the collaborative approach and managing that scale while all of the participants are doing the work and are accountable to each other and to us is producing the results that we drew up on a whiteboard in 2018.